Want your question answered? You've got to send a text message. Take out your cell phone and type out your question. Then send it to 336-379-5775. Don't call. You must send a text message if you want your question answered.
And here we are answering your questions. Cone Health's Dr. Zoe Stallings is answering your COVID-19 and vaccine-related questions. This first question says, if someone has had COVID, do they still need to get vaccinated?
Yes, you can still get reinfected. We don't know how much your natural antibodies and how long it will protect you. So we are advising that you get vaccinated with one of the available vaccines.
Okay, and just a follow-up on that, what is the timeline for that?
So we're typically saying that you don't want to run and get a vaccine right after you're out of quarantine. We do recommend that you wait about a month and then set up an appointment. If you go on conehealth.com/vaccine, you can see different ways that you can make appointments. And so that's a great resource because there's also videos and information about how the timing, where you should go, and what number you should call. So go on conehealth.com/vaccine.
All right, this person says, do I need to wait any period of time to get a COVID vaccine after having dental work? Specifically, I'm having a cavity filled.
No delay. Just go ahead and get your vaccine as soon as an appointment is available.
So this person is asking, does the mRNA cause your DNA to be affected, impacted, or edited in some way?
No. The mRNA, and this is across, in terms of science, it's hard to get into that without some drawings to show you. But in general, mRNA and DNA are not, you're not going to see an insertion in any way of the mRNA into your own body's sequencing. It does not change your DNA.
Okay, and then this next question is, does the vaccine cause false positives for imaging like mammograms or anything else?
Great question. I'm actually glad that came up. So in general, you can see that the vaccine can activate a lymph node. And that lymph node, especially in the area, let's say you had your vaccine on the left shoulder and the breast on the left side, that lymph node in that armpit or in some of the glands could be positive from the activation of your immune system, which can enlarge in the lymph node. So what I usually say is if you've had COVID, when you're scheduling your mammogram, let them know when you had the vaccine, because what they'll do is they'll either push back your mammogram appointment or anticipate that they'll see that. Some of the radiology departments are actually using that as a screening question to ask patients so that they're not alarmed when you see a large lymph node near the breast tissue. So that's a very good question.
All right, so this question is, does someone with multiple sclerosis need to be concerned about taking the vaccine?
Now, any immunocompromising condition, such as multiple sclerosis, any autoimmune disorders such as lupus, we're talking about people who are on chronic steroids, they in particular are highest risk, so they should get the vaccine. Do not delay. In fact, you are in one of the groups where we are encouraging you, talking to your specialist if you need more information, making sure that you check out Cone Health's town halls on the vaccine, but you would be a high risk population. On Cone Health's website, they also talk about the risk factors and how you can calculate a COVID score. When patients see me, I look at their COVID risk score, and it factors in their chronic underlying disease. And multiple sclerosis would be one, so we want you to get your vaccine.
A COVID risk score.
Yes.
What is that?
So it factors in age. It looks at underlying chronic disease such as diabetes. It looks at, do you have already a pulmonary disease? So do you have a lung disease already? And then it also looks at what current symptoms. Are you a smoker? And if you have some of those, it gives you a 0, 1, 2, 3, 4. And it tries to help us as providers think about talking about the vaccine and also helping to correct some of those underlying risk factors. So if someone has COPD, which we call emphysema, and they're diabetic and they're still smoking, they have a very high risk of complications from COVID. So on the screen, when you come to a Cone site, it will automatically say a COVID risk score. So if we see that person not wearing a mask, we're going to tell them, hey, put your mask on. Everybody needs it, but your risk is very high for complications.
Okay, good. Thank you for telling us about that risk score, because I hadn't heard that before. All right, this person says, if I took the J&J, if I have to get a booster, I don't want to risk the J&J again. Can I get a Pfizer booster? So let's tackle both of those things, the risk of the J&J and if it is too risky, and second, what about changing for another booster?
Okay. So on Friday, the CDC said that they're declaring that Johnson & Johnson is back to being safe. Right now at Cone Health, we haven't resumed vaccinating with Johnson & Johnson as yet. And so it's considered safe by the CDC. The numbers are still very good. There have been 15 cases of clots out of 8 million. The numbers are still good. However, we just haven't resumed yet. We're giving out the Pfizer and the Moderna, and you can check online for that detail. In terms of in the future with the booster, that is to be determined, because what will happen is, for instance, you get a 2-shot for Pfizer and 2 shots for Moderna, 1-shot series for the Johnson & Johnson. I don't know if in the future we'll have to give you 2 for you to start over with Pfizer, or if you're considered vaccinated and immune and we just kind of do titers. I am not sure what the future holds with that. So stay tuned. There'll be more updates.
All right, yeah, because the next question was like, I'd like to know how often we're going to have these shots in the future. And at this point, we just don't know.
We just don't know. Yeah. So get your shot now so that we can get more data and figure out what we'll need to do for the future.
Gotcha. Okay. All right. We've got one more segment with Dr. Zoe Stallings. We'll be right back after this break.